Hey everybody, Dr. Joseph Cipriano here, and today we have a receptionist, and she's back again. She obviously needs another adjustment. She's literally the first face you see when you walk into Palmetto Physical Medicine. So, we got to keep her nice and healthy because we need her to do her job. So, here we go today. So, what is going on?
So, today, it's not so much here.
Okay.
It's more through here, on this side specifically.
More on the left?
And then, down in the lumbar spine.
Okay, and then down on the back. Okay. All right, so I will definitely check that out. And just so everyone knows, I do have a mic today, so, I'm going to be clipping it on and just making sure that you guys hear a little bit better. I do know that, with the space in the office that we're at, it is a huge office, very high ceiling, so the voice and everything does tend to drown out. But, all right, so today let's go ahead. I'm going to get you to lay face down for me. Alrighty, so firstly, when I come up, I do want to check, I know she was saying she was feeling pain more on that left side through here. So I'm coming in, I want to palpate each side. I'm feeling the muscle tonicity, the texture. I'm just feeling if I'm feeling any knots, any tightness. Things like that are what I'm looking for. So I know her main complaint is really going to be right through here on this left side, and then also in the low back today. So in here, she does have some tightness running through her trap muscles. But let's go ahead and come further down. So when going through the back and going through the lumbar spine here, getting a little bit of tightness. How does that feel when I push it on the left side?
Very painful.
Very painful. And what about compared to the right?
Less painful.
Okay, so definitely more issues on this left-hand side. So I'll come down, take a look at her leg length here. So we have a short left leg is what's happening. So this is definitely everything on this left side, short left leg. Pain in the left hip, kind of going up in the left side of her back. So I'm going to start the adjustment right up here in the upper thoracic spine, and then I'm going to make my way down. There we go. Perfect. Got that to move very well. Okay. Take a deep breath in. Let it all out. Got a lot of movement there. And I'm going to drop down just a little bit lower. One more time, deep breath in and let it out. Good. Alrighty. So now is it tender up here?
A little bit.
A little bit, okay. Okay, so we're going to do a little bit of a different adjustment today, okay? First, I'm going to get to that adjustment in just a second. I'm going to check the hips first. I'll finish this out, and then I'm going to come back to this issue. So I'm going to push down and stabilize on your sacrum. I want you to raise one leg at a time, so raise this leg up as high as you can. Is there any pain, tenderness, tightness with that?
A little at the side.
Okay. Now I want you to now do your right leg. Okay. Do you notice a difference?
Yes.
Okay. So what's happening is her sacrum is being tilted to that left side. To the right side, which is making everything easier to raise up on the right side. But what's happening is the muscles and ligaments that would connect onto the sacrum on that left side, everything is very taut and pulling very tightly. So it's restricting her from raising that leg up. So first, what I'm going to have her do is I'm going to have you cross your bad foot over your good foot. Good. And then this is where I'm going to use the drop table to do a torquing technique on that sacrum. There we go. I'm going to have you uncross. Now I want you to bend this knee for me. Good. go. So now, as you can see, what I was doing with that is I was bringing her leg up as far as I could to tension and then making that drop, that adjustment in here. So now I want you to raise that left leg up as high as you can. Do you notice the difference?
Yes.
All right, let me do that actually with stabilizing the sacrum here. Do that one more time. Raise that leg up. Okay. So you notice a difference with that?
Yes.
Okay. Now, even to the touch, how's that feeling right now to the touch?
Better.
So better down here, but what about up here?
There's still a little tenderness there.
Okay. So what I did is we worked on the sacrum right here, more on that left side. But now what we need to address is going to be that upper lumbar, that lower thoracic. It's kind of a strange area because it's an awkward place to do an adjustment. So what I'm going to do today, what's going to be a little bit different, is I'm going to have you sit up. Okay, so what I'm going to have you do, I'm going to have you sit sit back on the table, but one leg on either side. Good. So with this, what I'm doing is I'm feeling on that left-hand side. This is where I know she's having a lot of the issues. And what I'm feeling is on the left side, her muscles are kind of protruding out more towards me. So what that's saying is that vertebra, instead of sitting straight back, it's getting rotated like this, and where those muscles attach onto that transverse process, everything is coming out, and it's creating a little bit of pain here for her. So what I'm going to have you do, I want you to cross your arms like this. I'm going to have you turn as far as you can over, to the right. Now, with your thighs, I want you to squeeze the table with your thighs, and I want you to look over your right shoulder as far as you can. And you felt that one, right?
Oh, before you even did it.
Yeah, just with getting her into the position and getting her into tension, things were already moving with that. So that's a very good thing. As she could tell, this is something that she needed today. Now, how's that feel when I'm pushing in? Do you notice a difference?
Better, yes.
Okay, good. Good. So even just that simple, easy adjustment, the pain, that annoying pain that she was having, it already, subsided that quickly. So which is a good thing. That's obviously what, she is looking for when getting an adjustment. But, not only does chiropractic adjustments help with a pain issue, there's a lot of things that are happening that one doesn't feel. Just because, our nerves control all the organ cells, tissues in the body is controlled by our brain. So our nerves are our pathways of, our organs getting the communication. And when there's pressure being put on that nerve, that organ, isn't getting the right communication. So that's all I'm doing is I'm finding areas in your body. You may note them as pain, but over time, it's causing a disease process in the body, and it can actually, shut down and harm those organs. So that's what I'm technically looking for overall. Well, let's go ahead. I want to do a cervical adjustment as well. We need to, obviously adjust the neck, just make sure everything is cleared up and in line there. And then also, we're going to do that Y strap adjustment at the end, okay? Perfect. So now that we cleared out the low back, which was the sacral issue, we cleared out that upper lumbar spine that was kind of causing an issue for you, and that was that new adjustment. I don't think I've actually showed that one. But yeah, now, so we'll go up to the neck, and let's see here. So we'll try first doing this seated. So I'll come around right to here. So we'll first try doing the seated. So what I'm feeling, I'm noticing how much she can laterally flex her head from either side. I'm feeling how the spine is moving from one vertebra on top of the other. Then, I'll do a rotation, just to check to see how everything is gliding off of each other. And then when I notice an area right through here, I'm going to have her bring your ear down to your shoulder. And now you can relax, turn towards me. Just quick movement, and as you can tell, you've heard that little bit of a crack. That's just that pressure being released off that joint. We're going to do the same thing on this side. a little bit bigger of a noise, but you know, just a little bit of pressure that just had to get released off the nerve there. But yeah, no, that was perfect there. How's that feeling? I know you weren't really having any complaints up here in the neck, but might as well, if you're going to get adjusted, might as well clear everything out.
Yeah.
So yeah, I'm going to have you just have your knees a little bit forward here. Good. And I'm just going to have you lay on back. Good, just like that. So now what we're going to be doing, we're going to be using the Y strap. This is a Y-axis traction device. It's going to go around the base of her occiput. I'll stand at the top of the table and I want to distract her spine out. It's a very good manual decompression therapy. You know, you'll feel this adjustment from all the way up in the cervical spine going all the way down to the, you know, to the lowest lumbar vertebra. And so let's go ahead. Lift your head up. Good. Hair's a lot shorter now, so makes it a little bit easier with putting this strap around.
That's why I did it.
And then I come up here right to the top. Now I just want to make sure I see that you do have earrings, but I don't want to cover those earrings. Now I know you felt that, and that, I mean, I heard that too, that just everything just just unloaded on that. So
That went really far down.
Yep. See, I mean, and that's why when I tell patients and I tell my viewers that, it is really a powerful adjustment. It's something that just, it opens everything up. It takes pressure off all of the nerves going down. Yeah, it gets a lot of great movement. So I'll have you come up. How are you feeling after that?
It was good. That was that sort of final
Yep.
final pull.
Yep. Yeah. So that's one thing that I really like to do, especially right at the end of the adjustment. Once I put everything a little bit more into line, then we do that decompression. So then when I decompress it out, it comes back and it'll be, realigned to where I want it to be. So yeah, after that, that's just such a great way to finish that adjustment. But how are you feeling?
Good. Way better.
Good. And that's the whole point. That is the whole point of chiropractic care. One, obviously, we want our patients feeling better. We want you to, just be able to live your life and, do things that, that you love to do. So I'm Dr. Joseph Cipriano over here at Palmetto Physical Medicine out in Greenville. If anyone's ever looking to schedule an appointment, we have actually lots of people coming in, calling up, leaving emails. What I do is I leave all my contact info in the video. And then at the end, if anyone does, call up or email, this is actually who you talk to. Erica's the one who gets anyone scheduled in. So have a good one, everybody.